Hello and welcome to all of you, and thank you for joining us today. This is the first of 6 sessions of the 2024 JCoR SDG Lab. And my name is Teresa Blumenstein, and I am the coordinator of the Justice Coalition of Religious, JCoR. And we are very happy to bring all of you together today for what we can consider a collective response to the conference that has just been concluded at the United Nations headquarters in New York, which was the 2024 High-Level Political Forum on Sustainable Development. And as part of this conference, many of the governments of the world, about 40 of them, were invited to give a presentation on the progress that they have made toward achieving the Sustainable Development Goals, which are the 17-part agenda of the United Nations system from the year 2015 until the year 2030. And so today we will have the pleasure of hearing and learning from several Catholic sisters, priests, as well as some partners in mission who all have some experience in relation to the first goal in the agenda, which is SDG number 1, to end poverty. And so we will be hearing from several different parts of the world. Some of them will offer good practices in relation to goal number 1. Some will present a critique of the way that their own government presented their progress on this goal. And others will also offer their own observations of how that goal is or is not being achieved in their country. So before I invite our first speakers to begin with their presentations, I want to remind everyone who will speak today that we do have a team of wonderful interpreters with us. And in order for them to capture all of the meaning in your wonderful presentations, please be sure to speak slowly and to speak as clearly as you can to ensure that the interpreters can convey all of your important content to everyone who is here with us in the room. So do not rush, take your time and be as clear as you can, as we are all eager to hear and to understand everything that you have to share with us today. And so with that, I will not delay us any longer, and I will invite our first speaker for today, who is Sister Franca or Francesca Edet Okwa, who is a daughter of charity, who comes originally from Nigeria, but who is now serving as a representative of her congregation to the United Nations office in Geneva. So, Sister Franca, you have the floor.
Good morning, Teresa. Good morning, everybody in this gathering. We are still trying to recover from the high-level political forum that we had, with great experiences and learnings. And it was most important to be able to meet some of our colleagues, the members of JCoR, in person. And for me, it was a great delight and experience. This morning, I'm speaking from Manhasset. I came to spend a short while with my cousin before I return. And so I am home alone. I don't know where things are because she's gone to work. I managed to find a place to plug the computer and all that. So we'll get on. The issue of poverty that we have been talking, we've heard so much from different countries and from our colleagues. This morning, I want to share how the Daughters of Charity in Nigeria and in Ghana have tried to mainstream their service of the poor in local communities for the eradication of poverty. And again, I am basing my work again on the work the sisters have been doing on human trafficking as part of trying to bring the young ladies, the young men who are trapped in trafficking, bring them out, give them a sense of confidence, and re-establish them in the society. I sent some slides to Teresa, please, and I would like if you can share the slides. So I'll take the slides one after the other and speak through the slides. Thank you, Teresa. So we have registered this conversation as the road to dignity. The road to dignity is the topic of my conversation this morning. May I have the second slide, please? There we have Sister Olivia Omo, who is the director of the Safe Child Advocacy Service in Kumasi, Ghana. She's a great advocate for the work against human trafficking and children who are found on the streets of Kumasi in Ghana. Next slide, please. This picture here shows, like you see, 3 girls who have just been brought out from trafficking. I use the word rescue. I don't know what word is acceptable here in the United States, but when these girls have escaped from their captors or are in some way rescued by the police, they bring them to the center where the Daughters of Charity are running in Kumasi, Ghana. We have permission to use these pictures. That's why I am putting them there. And you see how in distress these girls are. They have just arrived and they are waiting to encounter. We have recorded welcome there, but a lot of activities go on behind the scene to welcome them and make them feel at home. Second slide, please. So in the process of working with the girls, we look at the values like respect, compassion, charity, integrity, trustworthiness, and the mercy of God. All these values are put together to help the girls or even the boys who come to us, to put them at ease with the sisters and let them know that they have come to a place where they can find new life. And to find new life, their cooperation will be needed. So it's a mutual act of working with compassion, with respect, with integrity, and the mercy of God. Slide 2, please. Slide 3, yes. It takes a long time before the girls get to this stage. A whole lot of work gets done behind the scene, listening to them, having great conversations with them, trying to build them up. Sometimes they come with illnesses and they are taken care of medically to build their confidence, to rebuild their health, and to give them some sense of hope. After which, the girls, for those who are interested, are put into sections where they learn some kind of skills. And in this case, we see them, they are engaged in sewing skills and they are displaying their work. The sense and the environment now has changed from that of sadness into that of building confidence and bringing out what they themselves know and what they can contribute to the society. Next slide, please. Here we see that they are focused in what they are doing. One of the girls is focused on learning her sewing, and the other one is focused on salon, hairdressing, trying to bring about beauty once again, something they may have forgotten in the process of their suffering. Now they are trying to bring that out again, and they do that with some sense of confidence and determination. They are focused here. Next slide, please. This young lady has learned how to make cakes and prepare, so she is proudly exhibiting her work there and showing what she can offer, and she has a sense of fulfillment about what she can do. Next slide. These girls, by the time they have completed maybe some between 6 months and 9 months of constant engagement through the process of counseling, through the process of learning, through the process of interaction with each other, they come to a stage when they have learned something and want to show to the society. And this success is ritualized by celebrating them and giving them certificates of achievements. So we see them there together, standing and showing off their certificates, just to prove that they have become some new persons in themselves and are ready to go out again into the world and stand tall and stand up and speak up for themselves. Next slide. Here you have a group of sisters from different congregations come together who actually work with the young people who have been rescued. In this picture, you don't see girls, you see a lot of boys. So it's not only girls that are being trafficked in the different parts of the world. In Africa, West Africa especially, many boys are also being trafficked. And in recent times, when the enforcement officers encountered them, they had to liaise again with the Daughters of Charity, with the Catholic sisters around the different dioceses to also work to help the boys. Because this project is not, we don't have so many centers that can offer this help or these services to the people who are being trafficked. So the sisters end up having to attend to boys, having to attend to girls. And in this situation, we have seen boys that have been rescued and also have been helped to stand up again for themselves. Thank you. Still more girls showing some sense of coming together with the sisters, with other collaborators. It's not only the sisters, some lay people, some market women, some workers around the place have gained interest. Some church members have gained interest to work with the boys, to work with the girls. So they collaborate with the sisters, all in the effort to bring them out of that poverty and provide them a new sense of focus in life. Thank you. In this situation, you see that they have now learned a lot about the dangers of being trafficked. They are taking it upon themselves to join in advocacy work, to speak out, to be able to convince other people, people on the street, people in the marketplace, people in schools. They go around, they advocate, and sometimes this happens on special days like World Day for Fight Against Human Trafficking, World Day for Fight Against Poverty, World Day for Fight Against Violence against women, against children. Those are the special days that they take up to do this awareness raising and to let the world know that the injustice of human trafficking or the injustice of poverty around the world, around the society is unacceptable. Yes, Teresa. That's a repeated town hall meeting. At the end of a town hall meeting, they come together to take this photo, and just as part of showing the things that they are doing around the release of themselves from human trafficking. So that's all. I decided to show it in a very simple, basic pictures way so that we can see what the Daughters of Charity, and basically those two works have come from part of Nigeria, the Kusudo work in Nigeria, Benin City. Maybe some of you may have heard about it. And then part of the work is from Kumasi, Ghana. And these sisters from Ghana and Nigeria, they work together, because when children are being trafficked, either from Nigeria or from Ghana, they have to liaise to be able to send them back to their countries of origin. Thank you very much, Teresa, and thank you everybody for listening.
Thank you very much, Sister Franca. I especially like the components of this ministry, which involve ritualizing success and also an emphasis on skills that can bring out beauty as a part of kind of both the internal mirroring the external process of rehabilitation to rediscover beauty within while learning to create and bring out beauty in the world. This is a beautiful illustration of looking at poverty as one of the root causes of human trafficking and forced labor. And so the importance of addressing the roots of poverty in order to address trafficking. Well, thank you very much for the work that you do and the work that so many of your sisters are doing to address this issue.
Thank you, Teresa.
And next, I would like to invite Sister Beatrice Magaya, who is a member of the Congregation of the Religious of the Sacred Heart of Mary. And she is offering us today a perspective on work against poverty in the country of Zimbabwe. Sister Beatrice?
Yes, Teresa, thank you very much. I'm going to share with you all on our work in Chinhoyi specifically, where we are working with the community, the local people, which the communities are growing fast, extending from the town into the rural setting. So we started a project recently. 2 years ago, we opened a clinic in 2022. So we have been working with the people, seeing their struggles and trying to respond to their health needs, which also helps us to respond to poverty. So Teresa, I shared with you my PowerPoint. If you can share with on the screen the slides, it will help me to make that presentation. Thank you, and good morning to everyone. Okay. We have named the clinic RSHM Life Care Center. The name comes from our congregation, RSHM, and the life comes from our charism, which was taken from John 10, verse 10, so that all may have life. So this helps us also to share our spirituality with the people in Chinhoyi and surrounding areas. The people have got information about our clinic, so we have discovered that now more people are coming from around Chinhoyi because they appreciate our services there. You can have the next slide. So you see the image there, RSHM Life Care Center, that's our logo, which comes also from our institute logo. And then now our vision to be a cooperation of excellence in collaboration with our community partners. Then our mission to provide high quality, cost effective and comprehensive primary and preventive health care in the communities we serve. We are dedicated to the continuous improvement in services being provided to decrease health inequalities, regardless of the client's ability to pay. Our core values, work culture and caring, compassion, honesty, integrity, teamwork, community, excellence and quality education, teaching and training. We had seen that in our country, and especially in Chinhoyi, there were many people who were not able to access the health at the public places. And through our visits in the community, when we visit the sick, we discovered that a lot of patients were defaulting to go back for their reviews because maybe they were not able to find medication. They were not given their supplies, they were not available. And they would just get more sick and sick at home. So that's why we had said if we have a clinic, then at least they could come to us for their supplies and we could ensure that they have a frequent supply. So if you see there on the picture, there is some of our staff. We have young people who are working in the clinic. You can see there young nurses who volunteer to work at the clinic. One of them there with the image of the three sisters is one of our sisters. And the three, they are volunteers who give their time to work and give life at the clinic. And there you see the team of sisters there on the right who have who worked tirelessly to bring this clinic to life. So this was on the day of opening, in September 2022. And the sisters who came together to work there were there in this image. And you see our rooms there that we have. That's our observation room where we prepare our patients for consultation. And we made it child friendly because we have a lot of children who come for vaccination and treatment at the clinic. And on this image, you see our sisters there at the clinic helping us in ministry. We had our Institute Leadership Council came and we involved them in our vaccination day, which is one of our biggest day where we are able to give free services to the mothers and the children, and we get the vaccines from the government hospitals, so we are able to give the services for free, and it brought the services home to the people, so would be near the people there. And we also do growth monitoring. You can see the provision for the growth monitoring on the other side. Okay. So we have affordable health services. The RSHM Life Care Center Clinic is committed to provide affordable healthcare services to the deprived communities in Chinhoyi by offering a sliding scale payment system where cost of services is determined by the individuals or families' financial capabilities. The community is poor and some of the people are not able to pay or pay enough. So what we have done is to put a consultation fee of $10, but then we don't limit it to everyone paying $10. So we assess the needs of the families or individuals, and then we ask them to contribute what they have or to be given the services for free if they don't have anything. So you'd find that in a day, maybe we would have 2 people who can pay $10, some can pay $5, some $1, some they can't pay. So we just try to give life to all and to embrace all and to ensure that people get the health services that they want. Then collaborating with local government and non-profit organizations to secure funding and subsidies, which allows further reduction of the cost of health for the most vulnerable individuals. So we always look for people who would like to assist us, like our sisters from other provinces, they are sisters, and some local people who want to help us, they are sisters, so that we'll be able to keep the services going and to ensure that each one who comes to the clinic can have especially their medication. Like if they have chronic diseases, you would want continuity in them, in availability of essential drugs. Okay, next slide. So bringing primary health care and other specialized care to the community at affordable prices and ensuring that high quality health care is accessible and affordable. The clinic is directly contributing to the financial stability and overall well-being of the community. So with primary health care services, then the people do not have to travel far, like to the hospital, or to miss their doses, which may cause further complications. And we have a doctor also who is volunteering, a gynecologist who comes once a week. So we are able to do obstetrical special care at the clinic, and also he's able to see the gyne complications, so they do not have to wait for a long time the booking at the public holiday or at the public hospitals. Okay. So you see there's supplementary milk provision for children. This program started this year when some well-wishers helped us with money to help the children who were malnourished in the community. We find out that in our visits in the community, we discovered that there were under 5 children who were malnourished, and even under 6 months children who were malnourished. So these children, some of them would have lost their mothers at birth. Others were multiple pregnancies, so they were like twins, and then the mother was not able to produce enough milk for breastfeeding, so they needed supplementary milk. So you see this image, these are twins, and they are getting supplementary milk at the clinic monthly, so that we do not have all forms of malnutrition, and that at least they could have a better health. So we can have the next slide. So the clinic has identified malnutrition as a significant contributing factor to the cycle of poverty in the local community. Through the supplementary milk program, they provide a daily service of nutrient-rich milk to children under the age of 2 who are at risk of experiencing malnutrition. And a total of 40 infants were enrolled in this 6-month program. Okay. And this program is implemented in collaboration with community centers, ensuring widespread reach and accessibility to the service. The clinic's medical team closely monitors the children's growth and development, making adjustments to the program as needed. By addressing the nutritional needs of children, the clinic is laying the foundation for their physical and cognitive development, which is crucial for breaking the cycle of poverty. Okay. Meal provision for staff. You see the image there is the RSHM Life Care Center staff at lunch time. We have made it our way of operating at the clinic that the staff do not have to worry about what they are going to eat at work. That is their breakfast and their lunch, which helps also that at least they could be able to provide nutrition and food to their families, while at work they are not worried about that or working hungry, trying to save. As you know, the situation in Zimbabwe. So we make it our policy that each member of staff should have at least 2 meals while at work. Okay. The clinic recognizes that the financial stability of its staff is directly linked to the organization's ability to provide high-quality healthcare services. We offer a subsidized daily meal program for 13 clinic staff, including doctors, nurses, administrative personnel, and support staff. And this includes breakfast and lunch. The meals are prepared on site by the clinic's kitchen using locally sourced and nutritious ingredients. This initiative not only supports the physical well-being of the staff, but also contributes to their financial security as it reduces the burden of providing for their own meals. And by investing in the welfare of its workforce, the clinic is ensuring the long-term sustainability and effectiveness of its healthcare services. So our vegetables, we get them from our garden. We have a backyard garden at the clinic where we plant our own vegetables there. And on this image, you see two young people. These are students. We were fortunate enough to find one of the families who wanted to support us. We call it the Genino funding. The Genino family, they support us to send young people to be health professionals. So you see in that image, we have a student doctor and a student pharmacist. These young people, they have volunteered for 1.5 years at the clinic, and they are being sponsored to go to school. And they will come back to the clinic to give back after they are qualified also. And we have incorporated them to share in our spirituality. So with these ones, we feel that they have been a success. And I think they will be able to give for a longer time more free services to the community. They are also from within the community of Chinhoyi. Okay. So the clinic has established a comprehensive volunteer education program to empower members of the local community. The program covers a wide range of health courses. Currently, the funding that the clinic got has enrolled for medicine, pharmacy technician, and other one for acquiring basic O-level education. And these trained volunteers vow to come back after acquiring their degrees to give back to the clinic through provision of services. So by investing in the education and capacity building of local volunteers, the clinic is fostering a sense of ownership and self-reliance within the community, which is crucial for sustainable poverty alleviation. Community-based care program. The clinic recognizes that some individuals in the community may face barriers to accessing the clinic facilities, such as lack of transportation, physical disabilities, or social isolation. And to address this, the clinic has employed a community home-based care personnel who engages in home visits while providing a wide range of health. These services include basic medical care, chronic disease management, maternal and child health support, and social assistance. The home-based care personnel work closely with the patients and their families to understand their needs and provide tailored support. By delivering essential health care and social service directly to people's homes, the clinic is ensuring that even the most vulnerable members of the community can access the care they need. So our religious sisters also, they go into the community with the home-based caregivers, the community health worker. So it really helps us to see and understand the struggles that the people are facing, and to see when we are prioritizing, to see where the most need is. So through this comprehensive initiative, the RSHM Life Care Center Clinic with the Religious of the Sacred Heart of Mary are addressing the multifaceted aspects of poverty, aligning with the goals of SDG number 1, and by targeting nutrition, employment, education, healthcare, and community empowerment. With the support, the clinic hopes to continue making a significant and sustainable impact on the lives of the people it serves. Thank you very much. And that's all I have to share for now.
Thank you so much, Sister Beatrice. And what an amazing ministry that so well integrates at least goal number 1, to end poverty, goal number 2, to end hunger, and goal number 3, to provide quality healthcare. And it certainly extends beyond those 3 goals, but it truly includes each of them in a very obvious way, and represents a very clear sense of the interrelated nature of so many of the significant problems that affect so many communities, including yours in Chinoy. Well, thank you very much for that work and for your sharing.
You're welcome. Thank you.
And next, I would like to invite Father Milton Martinez Becerra, who is a Claretian missionary, to speak about work to end poverty in the country of Ecuador. Father Milton?
Good morning. I am Father Milton. I am not from Ecuador, but I've been living here for 8 years. And what I am going to share with you is a report about the first goal in relation with the work that have been done in our country. It's not about the Claretians, because we have already done that, but I will focus on the work that in Ecuador has been done. So that will be my presentation. In the voluntary national review that was presented to the United Nations, we have ratified how the goals were developed, because Ecuador is committed with the Agenda 2024 for the country. The National Assembly, for its part, adopted a resolution committing itself to the implementation of the goals and making them as a mandatory reference for its work. At the local level, different autonomous governments or groups or villages or parishes have articulated their planning for the fulfillment of the global agenda. And even the private sector, the civil society, and the academia have joined this national commitment under the premise of working together towards common goals to ensure equal opportunities and a dignified life for all. The methodology that has been used in order to work on the goals, just to put all the information together, was as follows in 5 steps. First, a statistical information management, just to see the work that is being done. Also, second, an information management from government functions in the different spaces, information management from different stakeholders, dialogue spaces and workshops, and the preparation, review, and validation of the report. The statistics on the goal number 1. In Ecuador, the response to the challenges caused by COVID-19, the response was with measures aimed to reducing poverty. I will share some statistics. By 2023, the income poverty affected 23.87% of population, and multidimensional poverty affected 36.92% of the population. That's according to the national report. The multidimensional poverty for June 2024 decreased 2.71% from 2018 to 2023 and stands at 36.92%. In the urban area, according always to the report, the poverty is around 23.37%, and in rural areas, it's quite higher. It is 65.95%. By ethnic identification, as the report, following also always the reports, white people have the lowest level of poverty, but here white people are considered as having a higher level of life, while indigenous people have the highest level of poverty with 80.64%. Let us say the poorest people are the indigenous people, Black people. With regard to the Sustainable Development Goal number 1 in Ecuador, I will share with you how the country wants to finish with the poverty in all its forms. 1. Eradicating extreme poverty, the action that the National Development Plan 2017-2021, and that plan is called A Lifetime, where it describes what is necessary for the population that 80% could have access to food, work, etc. With regard to number 2, reduce by half the proportion of people living in poverty, always in the same report, from 2007 to 2017, the poverty rate was reduced from 16.5% to 8.7% by 1992. And the goal was to reach 3.1. With regard to number 3, implement systems and measures of social protection for all. In the report, there is no significant information or changes. That's why I will not touch that aspect. With regard to number 4, ensure that everyone has the same rights to economic resources and basic services. In Ecuador, it was approved, the Organic Law on Rural Lands and Ancestral Territories. That was in March 2016, and that is in the Agenda 2030. And that project shows that the land access project for family farmers and mass legalization in the Equatorian Territory, so that all people have the same right to access the land. Number 5, in relation to the building the resilience of poor and reducing their exposure to extreme events, we don't have information in the report. That's why I will not consider that point. Up to now, we couldn't see any changes in that. Maybe in the future, they will consider that. Under 5A, to ensure the mobilization of resources and policies aimed at ending poverty, here there is a program of bonus. Many people that are receiving from the government bonus. For example, there is a program, Less Poverty program, with some bonus, human development bonus, and CDH, that is a development human credit, that we will see in order to help the society. In 1B, create solid policy frameworks at the national, regional, and international level. And we have 3 projects. There is the National Development Plan, a House for All plan, and the Human Development Bonus that I have already mentioned. Those 3 projects aim at reducing poverty. And 1C, continue to fight for the eradication of poverty and reducing inequalities. According to the report, there has been a reduction in income poverty levels with 25.2%. That was pre-pandemic at the national level, and 8.2% the extreme poverty, always the report. So in a general way, I wanted to show this comparison between the goals and the actions that we are doing in Ecuador, and that can be read in a report of 250 pages that was presented at the United Nations. Now, some results of the implemented actions. Among the implemented actions, we have strengthened cash transfer programs to help the most vulnerable. There was a promotion of economic inclusion through training and support for entrepreneurship, and with the collaboration of an international cooperation, the migrant and refugees families are supported, including the labor and work inclusion. Sometimes people don't see that support because they don't know the work of the Agenda 2030. And in the province, we try in the parishes and different groups to make the Agenda 2030, to make it known, because many people don't know the 17 goals. Here in Ecuador, there was a good idea, that is that the press every day or usually they remind one of the goals and what has been done, and what we want to do, or what is foreseen that it will be done, so that people know about it. But many people don't read newspapers, and that's why they don't know very well this reality. Between 2014 and 2023, there was a significant increase in remittance, which according to studies contributes to poverty reduction. Ecuador continues to search for sustainable, resilient, and innovative solutions to guarantee social protection and promote upward social mobility through access to public services. Now, I wanted to give you some figures with regard to the results that we are reaching, and that's coming from the report. 76,000 children under 2 years of age and pregnant women are served and helped in the child development centers, Growing Up Our Children program, something very similar to the previous presentation. 607 people are received that bonus that of human development that I have already mentioned. 178,000 beneficiaries are trained in the economic inclusion schools and schools for self-employment. 84,000 pregnant women and children are benefited from the bonus 1,000 day. Is called like that, the bonus. 303,000 elderly adults in situation of poverty and extreme poverty benefit with the pension that is called My Best Years. It's a bonus that goes around $50 and $100 according to the situation of the people. 270,000 family groups in extreme poverty with children under 70 years old are benefited with the bonus human development and variable component bonus, that is another kind of bonus. 3,800 children and teenagers that we were removed from child labor, because sometimes the family put children, ask children to work. So with this program, it was possible to take out of that situation to 3,000 children. 1,900 entrepreneurs now could begin with a business to offer their activities and products. 10,000 young people entered the continuous process of capacity building for economic inclusion. And that, according to the report, is 2000, from 2021-23. That's what I took from the report with relation to the first goal, because there is a report on each goal. That's what the government have done with regard to this. As Claricians, we also are working in a similar way in order to fight against poverty, hunger. Last week, for example, we presented in another forum what we are doing with regard to this point. Thank you very much.
Thank you very much, Father Milton. It is impressive to take more than 250 pages of report and to bring to us just the few most important points, especially those points that connect with poverty. And you have done us a service by bringing in the different dimensions of multidimensional poverty. And I thank you for the work of the Claretians to help to socialize and popularize the knowledge of the goals and Agenda 2030 in your communities, because as you say, if the people are not aware, they cannot also hold the government accountable or even identify the gaps and differences, as you said, between the national development plans and the promises of the agenda of 2030 agenda. So thank you for bringing a huge report down to a small report for us. And we appreciate your sharing and your analysis. I would now like to invite several sisters who are members of the Congregation of the Sisters of Notre Dame de Namur, who will share their reflections and ministries with us from projects that they are implementing in several different parts of the world. So we will hear in this joint presentation from Sister Elizabeth Boroma of Zimbabwe, from Sister Luciani Diniz from Brazil, from Sister Isabel Izika, who is from Democratic Republic of the Congo, and who will also speak about the United States. And if she is able to join us, we may also in this presentation hear from Sister Margaret Nziani in Kenya. But I don't think she is yet in the room, so we will see if she appears. But I would like to invite the sisters to begin.
Greetings to you all. She's speaking. Oh.
I would like to, before talking, so she changed languages. I don't, okay. Okay.
If you
Yes,
change your language channel, Isabel, I think you are hearing yourself interpreted.
Yeah, Yeah, I
Sorry.
tried to explain that.
So
Sorry.
Isabel, just change your channel to the same language in which you want to speak, and
Yes,
then
thank
you
you.
will not hear the echo.
I changed it. Thank you. I'm sorry for that. I wanted to speak in English, even though my English is poor. I would like to use it, and I'm sure you will understand the most of what I will be saying. I was saying that it was a delight for me to be part of the JCoR program for training this whole year because I missed it last year. And it was also a delight to have sisters of Notre Dame from different countries that were reporting this year and get them involved from the beginning to the end of the whole JCoR program. It helped them to understand already a lot and be excited on following the high-level political forum. Even the sisters who weren't able to come here because we couldn't bring everyone. We invited only 2 sisters to come, but those who were in their countries, they followed everything with excitement till the end, and they were very involved. It united us all around our mission and around our mission, our ministries and our people. We could see, compare what the government were talking about and what we do as Sisters of Notre Dame and how we feel about the people for whom we do our ministry. It was also a delight for me because this year, I think it was different. The voluntary review was a time of excitement to see how each government is being engaged in producing, first of all, that report, because the government must have, first of all, a will to come and report to when people from all over the world may be watching you and the people of the country watching also and judging what the government is talking about and what exactly is going on in the country. To make this, you must be humble because some of the government will say, what he talked about this, but we don't see it in the country, it is different. So it was really an excitement and also the involvement of civil society and other countries. I think that accountability will produce something that will encourage government to make progress and to have more political will in improving things in own country, because we can't believe that this year you report from same weaknesses and to come back in 4 years and talk about the same weaknesses or challenges. I think it is encouraging the government to do more in their own countries. Also, the events, side events are enriching. You go inside events and you learn a lot, some of the things you didn't know before. Out of all the side events I followed, what impressed me very, very much was, first of all, the exhibit of the country called Omar. And I went to their side event they were reporting how they are making, and they took really seriously the SDGs, and in SDG 1, they already reached 82.22% of achievement. I was amazed. I say, how can a country do such progress in few years? But it depends on how you take it seriously and what energy you want to put in that, in achieving. And that's what inspired me. And I was thinking, if every country comes here to decide event or went to that exhibit, it may inspire others to follow the example. To finish, I think I have two recommendations from for JCoR, or all of us. At the end, even at the beginning, I saw our sisters, I encouraged them myself, go to meet your government. When they finished the JCoR, I said, go to meet your government. And they did. It was very, very good, and it's an example how we can already create good relationship with the people we think that we are in opposition with them. But if we make good relationship with them, things will be easy, because if you have a problem, you know somebody you can contact. This is something we can encourage our delegates when they come, even though they have difficulties in their countries, to meet with civil society, to meet with government, to follow the report. But when we are here, they can take the opportunity to meet civil society, and also to meet all people of their government with whom they can continue to make connection when they go back to the country. The second is what Father was talking about, to encourage, or I don't know how, as a member of JCoR, how can we do that? To begin a campaign of education on sustainable development goals. If we go in many countries, people even do not know about sustainable development goals, things like that. They have no idea. We do ministry, they know that sisters, they are there to help people to do this, but they don't know that the government has a responsibility on them, on making their life easy, or working for the improvement of their lives. I think it's something we can encourage to in our different congregations or countries, or wherever we live, to begin teaching people about sustainable development goals, and how they can monitor the progress that are happening in their countries. From this, I go to our PowerPoint. We did a joint PowerPoint of sisters who were from different countries. What we do as SND, we take all our ministry and we go to apply it everywhere we are, in order to help on the same way. Those who have the strength or finance to help those who are weak financially, they help, and that's how in the whole congregation, the ministry are sustained, and we sustain one another or country from one country to another country, and we go to see for each ministry what is related to our to our carriers and our congregation. So we made this PowerPoint. Sorry for Peru, because Peru came in on the list late. We didn't include them, but we informed them it was late for them to join. The other thing is that South Africa also was on the list, even though they put the report online. I don't know, the last day it happened that South Africa didn't present. They have a reason, but we worked on the report they put online. Now I will call Sister Elizabeth to present our congregation, and then we'll move to Zimbabwe and South Africa.
Thank you very much, Sister Isabel. And okay, she has noted. So I'm going to take you through.
How are you?
Good. I am going to take you through our founding sisters of the Sisters of Notre Dame, St. Julie and Francoise. Our congregation, as you might not know or you might know, was founded in 1804, and it is an educational congregation whereby the purpose of the founding was to educate young poor children in the most abandoned places. Today, the mission of the Sisters of Notre Dame has expanded to assist all people made poor in the world and to transform oppressive behavior and systems. Our ministries as Sisters of Notre Dame, we focus in health, education, pastoral services, social work. SDGs are in 15 different countries and across the 5 continents, extending with people living in poverty, especially women and children in the most abandoned places. So as we try and reduce or end poverty through the SDG 1, over the years, the Sisters of Notre Dame have been engaged in informal and formal education to improve the standards of living of the less privileged, especially the women and children. We believe in women and girls' ability to improve their lives and those of their families and communities in which they live. The Sustainable Development Goals came to enhance what we as Sisters of Notre Dame de Namur have been already doing. This is clear in all our ministries in the countries where we are. Today we have a presentation to share with you from those countries that were giving their reviews for this year. It is unfortunate that South Africa didn't present this year, despite their report being online. Nevertheless, we will share with you what the sisters are doing to reduce poverty in South Africa. So in Zimbabwe, Sister Elizabeth and her co-workers at Sandra Jones Center work with young girls we have dropped out from school. And these girls are identified in the communities in which they live, and the names are submitted. After submission, assessment is done to see whether they suit to enter into the program. Then the girls are invited to come to the center where they will have a workshop for 4 days, and they learn different things to help them grow in their awareness, self-determination. While during that workshop, they are also assessed which courses they can get into according to their interests. So the courses that are offered will be hairdressing, catering, and beauty therapy. The girls will then be enrolled in those courses which are offered by different people in the town that they live. And the courses are from 5 to 6 months. And after they've started doing their course, they're assisted with bus fare, also food parcels while they are having the courses, so that they don't get distracted or lose hope, because they might be wanting to go elsewhere to look for food, but food will be provided for them and their families for the next 6 months while they are in training. They are also given bus fare so that they will attend the courses consistently. Following slides, please. It will be showing the girls already in training, serving food in a restaurant. We also have the following slides whereby they also go to give service at a funeral or wedding, and also serve the food. And the hairdressing skills training, our girls are then trained for different things to equip them in order to be sustainable. After they have finished the course, they will get employment, and they will be able to earn some money to take care for themselves as well as for their children. Some at that age, they would have gotten a child, because we deal with the 14 to 17 years old. Some would have gotten a child or two. So they will be able to take care of their own children as well as to assist their own families. Then I will take you through the South Africa presentation. I am glad to share with you that our sister called Mary McLaughlin was able to fundraise to start a garden. How she did this, she risked her own life by skydive, which means there was an organization that she had to get into a plane, and then she would dive and then after that event, money was collected for that good cause to start a garden. So there was a breaking of the ground, buying of materials for the garden, the seeds. People were also employed who were unemployed in the community. So by what she did, she eventually created a job for those who were not employed. And at school, because of poverty, some children are coming from very poor backgrounds and they lack enough food. So for them to continue to come to school, they are using those vegetables to make meals, and especially in winter, where they have to make a thick cup of soup for each child to go through the day. So Sister Mary did a great thing. From nothing, sometimes we say we don't have money, how can we start a project? But she had that dream of having a garden, and she did a good job by diving from the sky, and she's alive. And her age was, surely we also were really afraid that at 8 years, how could she manage? What if she gets a heart attack? But she made it. Thank you very much. Can we go on to the garden? Yes, that was the breaking of the garden at Kroonstad, South Africa. And next slide is showing all the irrigation and the vegetables. Then our sister Obey in the same town, Kroonstad in South Africa, is doing different projects that are income generating. So they also encourage people to do gardening, and they prepare the land and make manure that will be given to different families to improve their gardening, and that also improve the nutrition. And there are women who have been helped, who were very poor and who could not meet the basic needs of their families, who were trained in skills training of baking and also gardening. And these women are able to sell the products to different people, and they are getting orders from other organizations. When they are having functions, they will ask them to make in order, and then they'll bring for them to enjoy. So the nutrition is being improved, life standard of living is also improved, and children are encouraged to go to school from those families because they have food to eat. Next slide. So Sister Lou will take us through the Brazilian presentation. Thank you so much.
Bom dia, boa tarde, boa noite. Eu vou precisar de tradução, então
Good
obrigada,
morning, good
Vivian.
afternoon. So thank you, Vivian. That's me.
Vou falar um pouquinho da nossa realidade no
I'm going to talk
Brasil,
a little bit about our reality in Brazil.
que a gente está trabalhando com os
We are
trabalhadores rurais,
working with rural workers,
com crianças,
with children,
mulheres e
women,
jovens.
and young people.
E aí, para a gente lutar contra a pobreza, a gente vem
Fighting against poverty is something
reforçando a educação
that we've been
popular.
doing with education.
e seguindo os passos do nosso grande educador brasileiro,
And
Paulo
we
Freire.
continue with the steps of the well-known educator in Brazil called Paulo Freire,
E da nossa fundadora, Santa Júlia.
and Saint Julia, our founder.
Vocês precisam ensinar tudo o que
So we have
precisa
to
para bem
teach
viver.
everything that is needed to live well.
Então, no nosso centro, o Sorriso de Santa
So
Júlia,
we have a center, it's called Saint Julia's Smile.
nesse local a gente ensina
In this
adultos
place,
que não
we
sabem ler
teach adults that do not know how to read,
e também crianças e
and we
jovens.
also teach young children and young children and adolescents.
E a gente também ensina as mulheres a
We also
fazer algumas
teach women
coisas com suas mãos,
to do some things with their hands.
como costurar,
We teach them how to sew.
aprender a usar o computador
We teach them how to use a computer
e outras coisas que elas desejam
and
aprender.
other things that they might wish to learn.
Sempre partimos daquilo que elas
We
e
always-
eles querem aprender.
We always start from those things that the people ask us that they want to learn.
E uma outra área em que as irmãs estão muito
And another
envolvidas
area that we're very much involved in
é a luta pela terra. Por meio
is
da,
fighting for land.
por meio da Comissão Pastoral da Terra,
We have a pastoral commission for land
que ajuda eles a manterem-se na terra e assim
this
plantar,
helps them to stay in the land,
comer
and
e
it helps them to
viver
plant,
em sua
to
própria
eat,
terra.
and to live in their own land.
Então, assim, tudo está conectado.
So everything is connected,
E o trabalho das irmãs de Notre Dame no
and the
Brasil
work of the Notre Dame sisters in Brazil
está mais ligado com a questão
is
política
very much linked to the political issues
e a educação popular,
and the popular education or the public education,
e ajuda as pessoas a terem
which helps
consciência
people to be aware
dos seus direitos.
of their rights.
Thank you. Aqui vocês podem ver um pouquinho de Breves, que é um dos lugares no Brasil
Here
que o
you can
IDH
see a little bit of Breves. It's in the north of Brazil, and it's one of the areas where they work.
e é onde tem os IDHs mais baixos do Brasil.
And it's one where we have the lowest rates of poverty in Brazil.
E aí a irmã Sandra ensinando os adultos.
There
Obrigada.
we have Sister Sandra teaching adults.
So we go
Thank you
to
very much.
we go on to Kenya. Sister Margaret, will you please take us through?
Thank you very much, sister. This is Kenya, and there's a school for the deaf and mute. Those are deaf students, and we are helping them. They get education here in our school, Bishop Korir Memorial Secondary School, and it helps them because these are the student or children or students who are neglected by their family members because they are deaf. And it was like, what can a deaf person do? Can do nothing. So you will find that most of the children here, they are overaged. Some of them are even over 20 years because the parents didn't allow them to get education. But since we began this education last year, it has really helped the parents to accept, because we brought to them awareness that if we educate them, despite the fact that they are deaf, they can see and they can do so many things. So we help them, as you see the first picture there, We are from church. We attend masses Tuesday, Wednesdays and Sundays. So we are from church, then back to school. We are back to our daily activities of class. Then we have co-curricular activities, which helps them a lot. And also down the next picture there, you can see students in the farm harvesting some corn. We also help these students to know how to find or sustain themselves maybe after school. So we do some farming, we plant food, we weed, then we harvest, we store, then we start using at a school. So the students have learned those skills, and we have also parents meeting who come in. The picture is not here, but after they came in, we meet and discuss to them important information about educating this child or him or her child all round. And at this time, together with their parents or guardian, we started the project for farming, then for chicken keeping, which they are doing very well, and the students take big responsibility to make sure that they feed the chicken, they make sure they're clean, the place they're sleeping, they use those droppings to put in the farm where they have planted vegetables. So you see it's going around, and the chicken, they lay eggs. So sometimes we use the eggs for maybe Sundays for breakfast. And also maybe once in a blue moon, we have chicken. We also sell. So when we sell the product, we also get some money to get them even some more food, if it's beef or bread for them to eat. So they understand that after finishing the school here, they will not be idle at home. So it has brought a good message to their parents, because we also have some meetings with some important people who have different disabilities. For instance, last month, we had a blind chairperson for our county who came in to talk to them, encourage them, to tell them that disability is not inability, that we look at him, we see he's blind, but he's now a person who is leading others because he valued education, he was educated, he finished, now he's having a post in the government. So the students felt encouraged very much and promised to continue working very hard in school. And as you see, the students, it's also integrated with the hearing. We have some students there who hear, and despite we have the deaf. So it was integrated because we thought these children come from different families. And in those families, parents give birth. You can give birth to a deaf child or a hearing child, and they can stay together and mingle and socialize and do all the activities together. So we thought as a school, if we integrate, it's going to help them a lot. And this indeed has really helped these students because they feel accepted in their society. And even the other students who are hearing, they have also learned the skills in sign language. So sometimes in school, they're only silent, but they're just signing without even noise because they want to include others in their conversation. So they have learned those skills in signing because it's part of the lessons that they take in their classes, and it's really helping us. And most of the activities they do together, games and sports, and also even music, drama, they do together, choir practice for mass, they do together most of the activities. Only the class time we have separated because the deaf class, you have to sign, while the other one you have to talk. Only that we have separated, but they do all and most of the activities together. So you find that our school, we are growing together and we are encouraging each other to work hard and also focusing at the future, knowing that after the students complete here, what next? So we have already factored in, we know what next. They already know how to do some activities to be self-reliant. They can keep the chicken, they can plant food stuffs, and after planting, they can also they can also use in their families, so that when they go back to their families, they are not just sitting there and saying, what can I do? Sorry. Sorry, so the students, we cooperate. They cooperate with even the teachers who are teaching them in their various subjects that they take. Sorry, so in Kenya, this is the ministry that you are doing that touches people's lives, and also intending to help this child, because if we didn't have this school here, many of these students, as I said, they will be, even some of them will have been married at an early age, and then maybe boys, drug addicts, and doing other things that may not help them in the future. But we see we are molding them and they are coming up well. So we continue with those activities here and hoping that when they complete here, we might have a place where they can go like in college and pursue their career, which they may want to take. Thank you so much.
Thank you very much to all of the sisters of Notre Dame de Namur who have just shared with us. And in all corners from Zimbabwe and South Africa to Brazil to Kenya, and to your work at the United Nations in New York, you have clearly each given special attention to a group that is especially at risk of living in poverty, and looked at ways to bring out the skills and the potential and the gifts that each of those groups has to offer, and to help them to receive proper recognition for those capacities in the world. So thank you very much for all of those beautiful ministries and for sharing them with us today. And now we will hear from Ms. Marta Santos Romero, who is a lay partner of the Institute of the Blessed Virgin Mary, Loreto Generalit, and she will be speaking to us about the implementation of SDG number 1 in Spain. Marta, you have the floor.
Good morning and good afternoon. My name is Marta Santos. As Teresa said, I am a lay partner of the Institute of the Blessed Virgin Mary, and I am coordinator of Justice and Peace also for the development of the SDG at a local and general level. I have a presentation that I will share. The focus is the goal number 1, poverty. What I want to share with you, it's a vision of the present situation in Spain with an analysis of the voluntary national review that our government has just presented, and also with the presentation of other reports of groups of this civil society. in the last years. And in these reports, we have also contributed with our group. And at the end, I will share with you some projects where we are involved in order to give a local response to the different factors of exclusion in Spain that is mainly with regard to having a home. That will be at the end. Spain belongs to the European community, and we have a good economical situation, and Spain recognizes itself as a state of right. There is a social consensus with regard to social distribution and to eradicate poverty. Nevertheless, today we are far away from the first goal of the Agenda 2030. There are 12 million of people in Spain that are living in the risk of poverty and exclusion, and the situation would be much more serious without the protective actions of the state. And we think that we have an opportunity to make ambitious commitments. Ending poverty is a matter of guaranteeing rights and political will. We have the means to do it if there is a political will. So we believe that we have to continue asking a dignity of life for everybody. In the report of Spain, the Spanish report, there are many data with regard to 8 axes. That is a tool that was created in 2015 with goals and in order to put it to practice the Agenda 2030, and it's in relation with the goals to finish putting an end to poverty and inequality, putting an end to job insecurity, and 6, reversing the crisis in public services. And after analyzing the data, we prepared proposals that are in relation with 1, strengthen the welfare state to end poverty and inequality, and 3, protect labor rights to end labor precariousness. In Spain, we can say that the GDP per capita has increased in recent decades, but in some periods, but this has not translated into an improvement in the living conditions of the most vulnerable population groups. That's in part because of the increase in average income per unit of consumption after the invasion of Ukraine, because the prices went up, but also it's due to a structural poverty, that it's not only because of that, but it's a chronic situation that comes from far ago. The risk of poverty affects 20% of our population. And when we talk about poverty rate, we are talking about income that would be around 20%. But there is another index, AROPE, that talks about the risk of poverty and social exclusion, because it has to do with the expenses that you can do with your income. And we can say that in Spain, the population with severe material and social deprivation has increased in 9%. We could say that even if the income has grown, now there are more households that can't afford some things like having a good food or heating during the winter, or to have or to face the unforeseen expenses. And this affects some groups more than others, like women or foreigners or households with only a monoparental house, like a mother, single mother, or and handicapped people. Despite improvements in the labor market and the introduction of new benefits, there is a situation, there is a similar situation than 15 years ago. Even if the unemployment rate is 11.8, and there was a period when we had 30%, so nevertheless, there are 4.8 million of people suffering from severe poverty. That is to say, they don't have an income, or they can't afford to have the basic, to cover their basic needs. Some of our actions to improve the income of the population has to do with changes in our laws, like a wage policy, like increasing the minimum in professional wage. And so the minimum income guarantee and social protection. During the last years, we have increased the minimum in professional wage, even up to 45%. There was a reduction of part-time and temporary work. So, or sometimes part-time means some month of the year. And we tried to reduce the gender wage gap. But nevertheless, the difference is 8.7 points. On the other hand, besides the wage policy, there have been changes in the minimum income guarantee, the income replacement benefits, that is a minimum living income. That means those people who are not working for some kind of handicap or other situation, but there is only 45% of people that receive that. Those who could receive that for different reasons, sometimes because they don't know, or they don't have the papers, the documents, etc. There is also a childhood assistance complement, and the state continues with the social protection. The investment in social protection is around 28.1% of the GDP. And the challenge for the next years, Spain is a country with an old population. So more and more people will need a pension, and that's a challenge for the country. That is, you can find it in the report, and that's a need that will need to be covered. But there is another aspect of poverty, that is the expenses. We'll analyze the expenses of a household in order to see how and why, even if you have an income, not all the households can afford their expenses. We will begin with the increase in food prices due to the crisis in Ukraine. There was an increase in 20%, and others, like oil, 60%. That means that there is a 12% of the population that experiencing food deprivation in the last years of quantity or quality, and 10% of households that were forced to use emergency services of food aid. Those are households who suffer more of that. We think that it's up, so the expenses in food and housing and supplies, the expense is 63%. And so they are poor. The issue of housing is very important in Spain. The expenditure on housing is considered high when it represents at least 40% of total income. And people, those who can buy a house, 9.2% of the population are suffering that financial overburden due to housing payments, and 45% those who are renting, the tenants with high housing expenses. That means that they have to decide if they will continue to pay their housing or buying food or paying electricity or heating. And that means that many people don't pay their rent or their mortgage, and more than 1 million households have been evicted since 2008. The prices are going up, the house prices are going up, and the expenses of the state in social housing is very low, kind of 1.1%. So there is a huge need of housing in Spain, and that's one of the reasons of social exclusions in Spain. As we said, one of the proposals of the government is strengthening the welfare state with a national strategy to prevent and combat poverty and social exclusion. That means that besides the expenses of the state, education, health, social services, during the last years, they are trying to do things like controlling the prices of energy or to offer some helps for the transports or the energy for the population. But those measures now are finishing because it's considered that the situation is better. But there are many households that still need that help. On the other hand, in Spain, we need a long-term care model. We recognize many people as having the right to having a help from the state, and because of the characteristics of our society, the state has to see and to study how to make sustainable this long-term care model. On the other, and also, as we have said, we have to guarantee a decent housing by reinforcing its social function. Recently, there was a new law for housing because that will be really a problem for us. The different organizations, we have highlighted some challenges that are in the analysis that we have prepared. And that is to have a greater social protection, to improve the employment rights in order to end precariousness, tackling the care crisis, and to ask for a fairer taxation to guarantee rights. The next presentation is about two projects of the congregation in order to give a response to the situation of housing. The first one, it's a project of Caritas, and that is social insertion housing. And we have a contribution of the regional government, and the buildings belong to the state. And people can stay for a while there. And in one of the buildings, there is a team of Caritas. And in one of the houses, there is a community of 4 religious of different congregations. One belongs to our congregation, the other are for the congregation of Jesus and the Our Lady of Consolation. And the work of this group is to accompany single person or families with residential exclusion. We try to help people with the difficulties that led them to live in that situation so that they can live an autonomous life. In some cases, the families could afterwards have new possibilities. In some cases, it was not so easy And when the time to be there was finished, they couldn't reach an autonomy. And that's why we began with another association or project that is called Caravana Solidaria Association. There are people who own a property and put it to rent at a fair price for people who have been in other situations and couldn't have their own house. It's something that we began in the last years after COVID. Now we have only 3 apartments and 9 places. And so we tried that they find a place to live. And we accompanied them also in trying to find a job or the social help that they need, etc. And eventually the Institute works in advocacy. That's my office, networking with other social civil society organizations, and we try to promote structural changes in Spain and in Europe and at a global level. For example, we work with a network with another organizations called Futuro en Común, Future in Common, and we prepared a document for the forum of last week. This organization is in the Social Council of Development in Spain. So there are the different regional governments there and other social organizations. And the states consider that we are we are in contact with them in order to reach the goals of the Agenda 2030. This is a synthesis of what we are doing in Spain. That's all. Thank you very much.
Thank you very much, Marta. And what a beautiful journey from assessing the data, comparing it to your observation and experience, and concluding with how to address the challenges both in a direct and charitable way, and also through advocacy in a systemic way that hopefully can change or transform the components of Spanish society that continue to create challenges with housing, with hunger, with access to education, all of which, of course, contribute to poverty. I want to succinctly thank you all very much for your participation today. We have learned so much and come to understand the wide variety of ways that Catholic congregations and their partners are both monitoring the implementation of SDG 1 and also contributing to the implementation of that goal. So I thank you all for your sharing, and I hope you will all join us again at the same time tomorrow, where we will have a discussion in a similar way on the subject of Sustainable Development Goal number 2, which is to end hunger. So thank you again very big thanks to our excellent interpreters who have extended with us beyond time, and we hope to see you tomorrow. Thank you.
Thank you. Thank you, Teresa.
Thank you, Teresa. Bye. Thank
You,
you.
everyone. Have a good day. Obrigada, Sister Lucia. Okay.